But in part, I will tell you that this is not the organization that I was involved with 20 years ago. The symbols may be the same, the mission is still pretty much the same, but the tools and technologies and things that it's using, its techniques to make a difference, are in part changing as a function of time. So you're hearing now about the Institute of Precision Medicine, and today I'm here to talk to you about the Health Technology and Innovation Center. So in part, I will begin with just things that you already know. The world is changing rapidly around us, and in part, that's why our techniques need to change. Go back, please. Slide back. Great. In part, we know that patients are becoming more empowered. Physicians, in part, are changing what they have. They're giving up a bit of autonomy, but they're gaining teams. Care coordination has become a buzzword, and in part is very active to try to translate patients through the system and then ultimately out towards their homes in a healthy and happy way. Insurers have gone from just billing to the idea of managing populations. And then even the pharmaceutical and device industry are realizing it's not about their technology, but about the idea that they can actually fit that technology and treatments into a disease management strategy. Where we deliver healthcare is also changing rapidly. When I began in my practice, it was all about the hospital, but now it's about the healthcare system, both within and outpatient clinics. And in the future, as we heard last night, it'll be about taking that healthcare and health promotion into the home. We heard a lot last night about the varieties of new technologies and the wonders that are coming up every day from our engineers across the country and across the globe. The opportunities to use this technology to change how we deliver health care or ultimately to promote health is phenomenal. And you'll hear much more about this through the rest of this conference. But the investment here has been incredible. $4.5 billion has been invested in digital health technologies. Over 100,000 healthcare apps have been developed. This is now overpassed what we're now investing in devices in medical care. And the reasons why it matters about cardiovascular disease were in part given by Nancy's statement, which gave the amount to which cardiovascular and other related conditions are affecting lives of individuals. This puts it in terms of dollars. And if you look at the most expensive diagnoses in the US and around the world, you'll see that heart conditions, diabetes, hyperlipidemia, etc., are at the leading edge of this. The question is, can we use technology, though, to help address these issues? In an article in JAMA, we talked about the ability to use health applications and mobile technologies to, in part, address these huge and massive and global issues. The question, though, is, do we have the information that is needed to show that those new technologies actually work? We did a literature review, as is done by the American Heart Association, to try to see what is known about whether these new applications can actually help promote health and the 7 wonders that Nancy talked about, the techniques and foundation of the Heart Association. And we found that many of these were lacking the evidence that we actually needed. Rather than end this on a negative note, though, we talked about the need for researchers and health systems to get involved, to in part embrace this new technology and then try to discover which parts work versus those that don't. There is varieties of this. Sometimes when we test new technologies, we find that in fact there was limited benefit. This was a study we talked about last night, which showed that in fact among a small study, when they randomized patients to receive Fitbit-like technology to in part improve the weight loss, they found that in fact it didn't improve that. But you can look at this from a very different angle. In part, if you look at this from the other side, we talked about the degree to which these were now 2- and 3- and 4-year-old technologies and don't represent exactly what people are doing today. So there may be explanations for why this rapidly moving field hasn't been yet shown to be evidence-based. But that doesn't give us an excuse for not actually trying to evaluate these in more rapid and real-time manners. The other gulf that exists came from our first conference. This is a very interesting pose if you're into body language. On the one side was the tech community. On the other side was, yeah, that's me. And look at the faces. This was the digital divide that existed in that first conference. Here was my description on that conference. I'm a 50-year-old. I don't wear a smartwatch. I'm not tech savvy. I don't adopt anything novel without evidence. I'm your problem, which Dr. Harrington was very good enough to tweet out to the world. Peterson, this is actually truth, Peterson is the problem. So we've got it nailed. But there is a gulf that exists also at the both patient and physician level, not just with me, but in part, if you talk to physicians around the world, they're going to talk about the idea that are EHRs helping or hurting? What type of application should I be recommending to my patients? How do I integrate that into my practice? If you talk to patients themselves, they'll talk about the idea as, is any of this data meaningful? How do I interpret all this stuff that's coming off my watch? How do I get my doctor to actually care about using that to help make me healthier? So it really is this triangle between the digital and device application companies who are developing all this wonderful technology, the clinicians who in part have to figure out how to use this in their routine clinical practice, and ultimately the patient who has to adhere to this and buy into the idea that this can make them healthier. The American Heart Association isn't new to this game. It's become quite cliche to be involved now in tech. It's like the cool thing. I get to wear no ties anymore. It's great. But the reality is we were involved in this way back when. In 2007, they started to develop a heart attack risk calculator. We worked with various companies to develop a blood pressure monitoring system. We'll talk about it in just a second. Heart of Diabetes in 2009, My Life Check in 2010, an Intel large project 2013. You can look across this. But throughout the years, there's been a variety of cutting-edge efforts that are now becoming sort of just getting into vogue, but they were actually started maybe up to a decade before by the Heart Association. In fact, Dan Jones, when he was the president of the Heart Association, wrote this editorial talking about the idea that we should be using technology, working with systems to ultimately help patients manage their blood pressure better. In that day, it was a rather novel concept. But in fact, the Heart Association worked diligently to, in part, develop a technology along with Microsoft in those days that would allow you to monitor blood pressure in your own home environment. Not only did we help develop that technology, put into it the rules and guidance that came from our evidence and science, but we in part helped to test out the first times it would be used in a randomized clinical trial. Now this is back in 2008. We first tested it in a Kaiser system, which is sort of an integrated healthcare delivery system, but then we tried it in those very challenging institutions called Duke Medicine. In both of these, we found positive results, so we said, well, let's take it out of the randomized controlled setting and put it into community practice. Can it be used by average everyday citizens within Durham County? And lo and behold, it showed great promise there. So then we said, can we scale this? Can we take it to 17 communities across the U.S. in the check, change, and control effort? Again, we found differences in responses, but we did find overall that the program was remarkably successful in helping to start to change blood pressure. Now, working with various organizations, we're starting to try to, again, take this to a generalizable community level. So now I'm here to talk briefly about the idea of where does this center go, and I can tell you that each and every one of you has a great role today. It's to help us define what the center should be emphasizing. We want to emphasize sort of three things. First, the idea that we're going to engage you all and engage our patients. The ultimate goal of this, as we know, is to improve outcomes, and at that triple gold star would be to lower cost as well. In part, this kind of conference is an opportunity to bring together the tech world, the clinicians, the researchers, all devoted to the idea of how can we make our patients better, and then how can we develop the evidence to show that this will be the right thing to do. At the Heart Association meetings now has become a showcase to not only show the newest drugs and the newest devices, but also how new technology might be changing how we deliver care and the lives of our patients. Some of the competitions that we're holding there have been quite fun, and they'll be continued through this scientific sessions this year. The idea that we can use and put into these products the very best evidence in this idea of the AHA inside. Can we put into these things not only just sort of what you've come up with is what you think the right suggestions are, but what Nancy talked about, the newest guidelines which summarize the very best evidence injected into these products. In part, we have the opportunity to convene you all in settings like this so that together we can come up with what are the solutions for tomorrow. Ultimately, the goal is to have major impact. And the major impact, I hate to say, is very broad. This is going to be a challenge. There's a lot of challenging issues in cardiovascular disease as shown on the left side of this slide. Everything from blood pressure problems to peripheral artery disease to metabolic syndromes. So we have a lot of work cut out for us, and deciding which targets to go after first is a major challenge. In addition, what falls into the category of tech is also quite broad. Everything from mHealth to working on behavioral change, telemedicine, to decision support you heard about last night. So in part, the goodness is that we have a lot of opportunity to make a difference. The challenge is there's a lot to do. So in fact, I'm happy to have a lot of friends together to help make that happen. Some ideas we've been having about exactly specifics the center will be taking on. In part, it'll be a clearinghouse where new technologies can be both vetted and ultimately those that are shown to be effective to be disseminated. We'd like to help to guide both physicians as well as patients to understand what is working out there and what are the opportunities to develop these new technologies. We want to integrate this in with the AHA's Institute for Precision Medicine because, again, there'll be great amounts of data, and this in part will both contribute data, but we'll use that data to help understand what is working and what is not. Ultimately, we want to work with you as those innovators in the field to determine how we can best use your innovations to deliver better cardiovascular care and ultimately better cardiovascular health. And then finally, with the idea that we might help you as well develop systems that where you can test out your new technologies and those that are found to be effective to be disseminated to the rest of the world. How can you get engaged? Well, there's multiple opportunities. I will advise you to talk to Patrick, who's the expert on this, but there'll be a number of different opportunities where small companies and large companies can work together in terms of how they can partner with the Heart Association both to test out their technologies as well as put AHA inside. So as an end note, I'll just note the AHA has been a remarkable organization to work with. It's got the right goals in mind and the right mission. It has the right capacity and reach and brand associated with it, and ultimately can bring together and be a convener of you and us working together for good causes. Thank you very much.